Awesome. All right. So good morning, everyone. Happy Thursday morning as we continue our weekly webinar series. We're so excited to have you join us this morning. Just a couple of housekeeping things before we get going. We've got a couple of presenters from across the state who are going to be chatting with in panel style discussion. So for the sake of making sure that everyone's volume is able to be heard and whatnot, if you are not one of our panelists, if you could please mute just to make sure that we are keeping background noise to a minimum, that would be great. This is being recorded, so we'll be able to share this out with folks. Before we get going, I just wanted to give a quick shout out of thank you to the Southern Vision Alliance COVID-19 Community Response Grant. Through their support, we've been able to continue these weekly webinars. So a huge shout out and thank you to them as we continue these weekly webinars for the foreseeable future. And I am super excited today to be joined with some community advocates from across the state. We've got some folks from Wilmington and from Greenville who are great advocates and who are also some long-term survivors of HIV, who will be sharing some information about their story, how COVID-19 has impacted them, and kind of what we can learn from the AIDS crisis of the 80s and 90s moving forward into COVID-19. So welcome to NCAAN Chats, Long-Term Survivors in COVID-19. And I will now turn it over to our panel moderator and the Barbara Walters of the North Carolina AIDS Action Network, Rita McDaniel. The floor is yours.
Good morning, good morning. Oh, I'm so excited on this morning. Thank you all for coming out and joining me this morning. I call it a talk show because it's different from the webinars we have been doing, and we're gonna have a real conversation today. So I hope that you all sit back, enjoy it, learn something, and ask questions. My first introduction for today is Jeff Mills. Jeff is 72 years old. He uses he, him, and his. He's a longtime survivor of HIV and AIDS. He uses Medicaid, Medicare. He has lived in North Carolina by the way of Wilmington for the past 7 years. After living 42 years in the Bay Area of California, he advocates for elders as well as for people living with HIV, AIDS. He is now an active volunteer in organizations such as SAGE, NCAAN, the Frank Hart Foundation, AARP of North Carolina. Welcome, Jeff. Our next speaker is Esther Ross Hines. Relocated from New York in 2000, married to the same handsome man, Jerome, 3 times, whoop, whoop. And they are currently residing in Greenville, North Carolina. Esther earned her social worker's degree from East Carolina University and master's degree in human services counseling, executive leadership. She is currently employed at ECU Adult Specialty Clinic, Specialty Care Clinic, excuse me, I apologize, which serves 1,700 clients living with HIV and AIDS in Eastern North Carolina. Welcome to you as well. We have a few other ones that I don't have a bio on. We would like to give a quick introduction of yourself. If you're online, it would be greatly appreciated. Anyone else? Okay. I guess we can go ahead and start with the questions. I want to give a brief background of why I decided to pick a topic. I wanted to do this. Recently, I was hospitalized and had to take a COVID test. And being a longtime survivor myself, there were so many relationships that I could compare from the early years of being HIV positive to COVID-19. So I wanted some experts to come in and have this conversation, and we could have a dialogue about the similarities that are going on today. I have a few questions that I would like to start off asking, if you don't mind.
No.
And please forgive me.
Take your time.
Okay, reflect and compare your experiences during the early years of HIV to COVID-19. What are the similarities and what are the differences between the two? Either one can go first, it doesn't matter. Whoever wants to answer first.
Okay, so this is Esther. I recently celebrated 27 years living with, or HIV living with me, and I'm so grateful to be here. You know, the COVID-19 really has me re traumatized regarding um, this social isolation and stigma, and really how they going about with COVID-19. I recently got a test, and I was amazed at how um, they put on all this gear to test people. And my early recollections of when HIV first came out, I was a correction officer in New York, and they did the same thing whenever we went into a cell and a person had HIV. So it is, both of them are so similar, and it just brought back all those feelings of not knowing, you know, what's going on, what it is, and things like that. So it's really similar in a lot of ways.
Thanks, Esther. So I'd like to start off. Hi, I'm Jeff Mills. I'd like to shout out to my fellow Wilmingtonians who are joining us here on the panels today. Esther Murphy, Dallas Majette, and LaShonda Wallace are here. Thank you. And I kind of wanted to open by saying that the correspondence between COVID-19 and the outbreak of HIV/AIDS is all too eerie for those of us who were caught up in it back in the 80s and 90s. Similar to HIV and AIDS, the authorities have been in such denial, and were back then, that there was a certain amount of panic, if you will, or disinformation going around, all mainly by word of mouth. And it's not that dissimilar to today with COVID-19. Most of us are all relying on each other to remind ourselves, you know, what are the important protections to take for each other. Back then, it was know your sex partners, use condoms, and minimize your exposure. And today, similarly, it's we need to remind each other, wear masks, wash your hands, use sanitizers, avoid contact with groups of you know, larger than a few people. In that regard, it's very reminiscent of HIV/AIDS. One thing that's very different is that the infectiousness of it is poorly understood. It kind of took years to understand where HIV/AIDS, how it was transmitted, but nowadays we know pretty clearly, you know, that the virus lives on surfaces and can be aerosolized. So it's kind of, you know, it's for me personally, I have an advantage over many people today, I think, in that having lived through exposure to very frightening epidemic. I feel better prepared nowadays. I'm not as terrified as I was back then. I don't know. Maybe it's just a certain resignation, but I'm just not as terrified this time. But maybe we should be.
I have a question for you both. Through this whole epidemic with the HIV, we always had plenty of condoms to protect ourselves. You could get unlimited condoms, and that's what everyone was told to use, was condoms to protect themselves from transmitting the disease. With COVID-19, we seem to have a shortage of supplies and protection. So how do you all feel about that? What is your goal for our community? And that this is a highly, HIV was worldwide also, but this has never been to a point where businesses were shut down, schools were closed. So how do you all feel that there was not enough protection out there versus when we had condoms?
I'm so grateful that in our community, they have, rallied around recognizing that there's not enough masks. So they've been making masks, donating masks. The other issue of protection of social distancing, I think people have a lot of concerns about that. I see people really doing that, and then I see people that really, that's not their main objective, is to do distance themselves, especially from loved ones and family members or friends. So when I look at the protection and compare the two, at least we had a condom. Now it's the social distancing, it's the mask, washing your hand. So it's more things that you can do, but again, when I do it in comparison, it's the same thing when it came out with HIV. People knew that condoms was the best way to protect themselves from HIV. Did everybody use them? No. I was one of them. I did not use them. That's how I got diagnosed with HIV. So I see the protection is taking it seriously like they did with HIV. I mean, they didn't take HIV seriously, and they're not taking this COVID very seriously.
So again, I think the commitment of the society to make the financial investment, the investment in time to educate the population is going to be critical. It's rather appalling that there aren't masks and gloves and sanitizer readily available and plentiful for everyone, because it would help, stem the spread of the disease. Perhaps with education, that will become less of a problem. But I'm coming up on in August will be the 31st anniversary of my testing positive for HIV, and I've had a long time to educate myself. But the COVID-19 affects not just a small subset of the global population, but it affects practically 100% of the population, and that presents sort of a barrier to education that I don't know, we haven't had to cope with in my lifetime anyway. And that is going to make things happen very slowly, I'm afraid. But it may end up that education becomes one of the major tools, educating people about the spread of the disease and the nature of it. Has to be done in a truthful, honest way and expeditious way. And if we don't have the government and the society on board with that, it's going to perhaps endanger us for a long, long time.
You know, you could find things everywhere. The corner store, the health department, there were just an abundance of condoms. And that's not so for masks. How do the nationwide precautions we are taking make you feel now? And do you have any fears as far as COVID-19, and what gives you hope? Did someone say something?
One of the things that I fear very much is that you know, where I work at, they offer the test, but they haven't tested their staff, and I have a real fear about that. And especially now with the new guidelines, is that people can pass on COVID and have no symptoms. That's a real fear for me. And now that my immune system is at a point where, you know, I'm undetectable, I have a good immune system, you know, my fear of contracting it is very high. And for others that's living with HIV, I mean, my concern is that I haven't seen any data to really that's saying how many deaths that we have had in this country. Out of those deaths, how many were HIV positive? And you know, I would love to see that information, because that would empower those individuals, especially those being diagnosed and long-term survivors. That would better empower us to know what else we need to do. But this uncertainty is very fearful for me. I don't know if it is for you or Jeff or Terry, but it is for me.
So I fear that the denial involved is going to slow down or prevent the investment in testing and in vaccine research. Right now, it seems that vaccine research is going full bore. That presents its own problems. Maybe there will be oversights and mistakes made that could endanger people's lives, because a vaccine is going to be readily embraced by the entire planet if and when it appears, and how safe it will be becomes a concern. I'm concerned that social distancing will not be pervasive enough to keep people like my 99-year-old mother from being exposed. You know, I have to be especially careful for her sake, not to be exposed, as well as for my own sake. So that's a big concern. So basically, I fear the denial is what I fear, but I'm hopeful that that people will understand, and the denial will gradually fade, and people will be socially distancing in a real increasingly safe way.
Why the both of you were talking, Jeff, do you have Terry, do you have anything that you want to say? Okay. I was thinking about and Medicaid. How do you all look at stepping up your game or being more proactive with advocating for things such as not only condoms and Medicaid, but we also need the mask and the gloves. We're supposed to go through, talk is, I don't know this for a fact, that there's supposed to be another wave of COVID-19 that's supposed to be harder than the first wave. So what do you think we should do as a community as far as advocating to get our legislators to say, hey, we need this money for this? What are your thoughts?
Go ahead, Jeff.
So Medicaid, there are a couple of competing issues here. I think COVID-19 has brought into the spotlight, how important public health coverage really is. And Medicaid as an existing program shows how successful public health coverage can be. By the same token, the health system is, on the verge or, stressed by the overwhelming aspect of COVID-19. If, for example, another wave materializes that's even stronger, the healthcare system is going to be stressed beyond belief, and hopefully, public health coverage will become a fact because of the danger from COVID-19. So it's good and it's bad.
I think we need to, thank you, Jeff. I think we need to rev up our advocacy efforts around Medicaid, especially around those states that have not expanded Medicaid or have some kind of plan in place, because people who are not insured are gonna, I could see that they will be, and those who are uninsured that have medical conditions from vulnerable populations will not be afforded the opportunity to get treated or get tested for this COVID-19. And I think that's a real factor into the deaths that we have in our society. So I would encourage or challenge each community member to talk to their legislators to let them know that this COVID is, you're not exempt from it. And you need to make sure that every person is insured or receive the insurance like Medicaid to be able to get tested and get treated. The same thing that we put out there for HIV, I think that we need to rev up our efforts in making sure that they realize that having HIV and COVID, now that they don't have any data, it's going to be catastrophic, in my opinion. And especially the social distancing, which is like social isolation, which is a lot of the things that people living with HIV that are living with it and older, they go through social isolation. And now on top of this social distancing, I think we're going to see a wave of a lot of reoccurrence of different things coming up. And if we don't get a handle on it before time, I'm just fearful. I'm in prayer mode. I pray a lot because there's so much uncertainty. I'm concerned about how this is unfolding. We even have our greatest healthcare workers who are donating their time and services. They're becoming infected, and it's just a critical period in our lives. And Medicaid, I mean, we still need, whoever can advocate needs to continue to advocate. I don't know if I answered the question, Rita, but.
Thank you both. I'm going to direct this to all of you. Terry, I would like for you to chime in, and also Esther Murphy. There used to be a time when people were afraid to get tested for HIV. Do you think the same thing will apply to getting tested for COVID? One of the things that I worry about is communities of color not having access, the elderly not having access, and other high-risk populations. So what are your ideas, or what are your thoughts on the fears of getting tested? Because, you know, just like with HIV used to be, and back in the day, there was a fear of dying. And some people don't want to know. You know, they would rather just let it happen. So Terry, Esther Murphy, and all of you, would you chime in, please?
Yes, I'd be glad to address that. It is a big concern because of my personal experience in 1991. I was high risk and hospitalized for an accident, and an intern suggested that I be tested for HIV, and the hospital refused. So I've had a personal experience prior to Jeff and Eddie arriving in Wilmington of stigmas here around the HIV. We were a very highly concentrated population of HIV in Wilmington, but it wasn't handled well. And I have experienced the death of a neighbor just this month, and it's been devastating. I live in senior housing, and my neighbors were visited by their great-grandchildren from New York City, and their entire family were infected. And it's been 2 months of just unimaginable hell, with this family breaking down and being in ICU. And they were quite sociable. So I know that I have other neighbors who were exposed to it here in this building. But the management and the reaction for the primarily rather conservative people here was to absolutely not talk about it, as if there was a law against discussing it. And the people I know that were closest to my neighbors are not wearing masks. So this schism between the acknowledgement that we all may be carriers and concern for one another over the embarrassment that you may have been exposed and you have to keep it a secret because it's going to affect your employability. And we have a president who is saying that testing is making our numbers look bad. Because, you know, it's insane. So when I go out with my protective gear, it's not really, it's homemade. It's not really, it's not hospital, but the gesture of it, it's going to keep me from touching my face. And especially when I see young people, I'm like, hey, you might think you're going to live forever, but guess what? I'm a carrier. I've been exposed to this. So, you want to keep your distance from me. I have to go get groceries. But I'm very direct with people because I feel like I have to overcome the the attitude that this is some kind of a hoax, and it's been devastating. Of the pain that my neighbors have gone through. Nikki's now a widow, and her daughter is compromised, and her son-in-law is estranged from the quarantine, and it's bad.
So I think the elderly are especially getting it from a lot of different directions. The terror of having it become a certainty, a certain fatal condition for the elderly, causes them to be afraid, not only for exposure, but to be tested, as we said. But then a friend of mine was just recent at-risk friend was recently hospitalized for a heart attack and received some catheterization, and stents were placed. But the 3 days that he was in the hospital, he was not tested for COVID-19. I don't know why. Perhaps the resources are not there. The testing that is available through FEMA or whatever the source is to our county here, the testing has to be reserved for symptomatic people, perhaps. But it's sort of beyond me how somebody could be, and my mother actually was hospitalized also during the lockdown. And she was not tested for COVID either. It sort of baffles me, and sort of, that's one of the things that I fear, is that the commitment to testing is not going to occur. We should all be able to be tested, especially for antibodies would be a kind of an informative test to have available to any of us, multiple times a month or a week. Hopefully that's going to occur, but perhaps the limited, as much money as they're throwing at the economy to prop it up, that kind of money needs to be thrown at testing and at vaccine research and treatment and PPE. Sometimes the priorities don't feel like they're really straight around here so far. But if we could advocate, as Esther, you said earlier, with our legislators, that would be an ideal situation.
Terry.
Hi. I am coming up on HIV positive for 36 years. And I'm 71. The thing that strikes me about the similarities is the fear that people have surrounding it. I remember how people were frightened of touching a doorknob that someone HIV positive had just touched, or breathing the same air would cause them to have HIV. I sat down with my doctor and discussed the issue, and he said, Terry, it's really hard to get. You have to do a handful of very specific things to come in touch with HIV. And the fears that people had then are true right now with COVID-19. It's just amazing to me that people are walking around without masks I just think it's now the chickens have come home to roost, because the greatest fears that people had for about HIV are now true for COVID.
Esther, do you have a comment?
Yes, so I think a lot of fears is surrounded around testing. It's unfortunate, but where I work at, their conversation is that if you are viral suppressed, your immune system is good, you don't need to get tested. And I'm in direct conflict with that, especially with the elderly, especially with individuals that have HIV, other medical conditions. I think that, those populations especially need to get tested. On top of that, I think it's a lot of fear from the community to get tested, because if they test positive, they're basically is going to go into isolation. And I think there's a real fear of being away from their family, being in a hospital where there's no one there to advocate for you, is a real fear. And when I hear that because I have a support group that we've been having for the past almost 10 years, and we had to go to Zoom, and those are, I think that's the most disheartening and discouraging thing, is that, okay, I have this, I'm in isolation, no one is touching me, I can't have my family members there, I don't know who's going to advocate for me, who's going to take care of this, who's going to take care of that, and they saying, well, I don't even want to know. The same thing like with HIV. I don't want to know. If I don't know, then I don't have it. And I think that needs to come into place, where we do need to have a specific comment stating that people who are HIV positive and have a medical condition, they do need to get tested.
Thank you all. This seems like a gloomy subject, so I don't want to stay on the gloom. I feel like the things that have been positive is some of the videos that have come out online, where people have made songs about COVID-19 and washing your hands. Can you relate to anything from the 80s and 90s that would apply today? That's something that's positive. What do you feel like has been positive out of all of this? I can give you a whole list of things, but I want to hear from you all. What's positive? We don't want to stay the gloom the whole time, but I would just love to know what positive, whether it's something you've done, family closeness. I would like for all of you all to give some feedback.
Hey, Rita. This is Tony Franco. How are you?
Hi, Tony.
Hi. Hi, everyone.
Thanks for joining.
Oh, gosh, sorry I was late. I had to go take care of, I'm at work and I had to do a couple things. But so just to go back, before we go ahead, I just want to thank you guys for doing this. And I just wanted to talk, just go back to what Esther was saying. And hi, Esther. I was thinking that what Esther was saying is so true, and you guys have done such a great job by putting long-term survivors together here, and thank you, Rita, for that. But would it be really great if we could create a network of people that NCAAN could maybe help with? I know that Matt had even mentioned to me in an email a couple of weeks ago about how difficult it is to do one-on-one, outreach now. But wouldn't it be really great if if we could act as sort of a connection for long-term survivors. I've been HIV positive for 32 years. In the state, to make them feel like they're not alone, you know, Esther, to make people feel like they don't have to be afraid to go get tested, because if they're positive, what's going to happen to us, you know, is going to be similar to what we experienced all those years ago when we had to hide out. Wouldn't it be great if we could figure out a way to connect everybody on this meeting and everybody else that's part of our stakeholders around the state, you know, long-term survivors who need support right now, to not feel alone, to do this on a regular basis, or even to communicate not through Zoom, but through chats or the website or something. I think that's such a great point, Esther, and I think that we shouldn't let that die, and what you're saying, and that we should do something to facilitate a group of us statewide that can, you know, share things, be a part of a group, you know, advocate to the legislature for expansion of Medicaid, all the things that NCAAN is doing. I just think, don't you think, Lee? Don't you think, Rita? Matt, don't you think that would be just, this is so great. We shouldn't let this.
I agree.
You know?
I agree.
Okay.
We need to get in touch with you and see how we can, all of us come together and make this possible. Tony, I don't know if you heard in the beginning, but I wanted to do this discussion was because I was tested for COVID, and I felt isolated. I felt dirty when you know, they came in one way dressed, and then they went back out and they put on all this garb, and it was like, what did I do? And then when I told them that I was claustrophobic and I couldn't stay in the room by myself or hook me because I was gonna leave, it just brought back so many memories. And you know, as all of you all have said, you know, this is a time where, you know, your loved ones are dying and we can't be close to family. And, you know, you said about the antibodies, I didn't even know people were carrying antibodies. So that's the good thing. I've been tested twice. They never mentioned anything about antibodies or being exposed. And this is information that we don't have. We do need to keep that connection, to keep everybody's spirits lifted up. And to say again, as we said years ago when we finally got medications for HIV, this is not a death sentence. You know, if we can advocate for testing and clinical trials, and there are a few that are going on. You know, if you've been exposed, they want, you know, for you to come in and give a blood test. But we need to advocate for data. It's like Esther Ross said, there needs to be data on our elders, people being positive, the trans community, because I'm not totally convinced that everybody is dying from COVID. This is just my thought, personal thought. But because it's a pandemic, they want the numbers to be high. I don't know if this is a money thing or a power thing, but I can't believe that all of a sudden all these people are dying from COVID. So it's got to be something else, but they're just classifying everybody in one spot. So like I said, if anybody has anything positive, I know that Matt has a few questions that have been sent in. So I really appreciate you all doing this today. This has been wonderful. And if no one else has anything to say, Matt, I'm going to turn it over to you.
This is LaShonda. Can I just say something before you go, Matt?
Yeah, go right ahead.
On a positive note, as a care provider, I will say that I've only had one person that I've cared for personally that was COVID positive. And I will say that in our setting, we are screening those who present with symptoms, and we're not screening people that are asymptomatic. But the results have been showing that people that are positive are not they have not been demonstrated to have a disproportionate effect of COVID-19 compared to the general population. And I just want to applaud everyone that is living with HIV in their courageous efforts to not only take this opportunity to stand up for themselves, but for the general population because of what they have experienced, being very vigilant with protecting themselves and knowing the benefits of being proactive instead of reactive and being able to share your story. And it's been extremely helpful. I mean, there's a whole bunch of things I probably want to say, and I'm sort of getting lost in my train of thoughts. But just thank you for treading the path that we are now experiencing. And if you know anybody that need masks, people have stepped up and they have donated masks to our organization, Seeds of Healing, for anyone that you know is positive that who do not have resources. And we're just like hoarding them and keeping them for our clients. So, so welcome to reach out to me. I'm LaShonda Wallace. I am in the Wilmington, North Carolina area. Kudos to Jeff and the rest of you guys for always being on the front lines with advocacy. You definitely have set a precedence upon this. Oh, I wanted to mention the point about no, everyone is not dying from COVID-19. And it is important to mention other comorbidities because there is always a direct link. So for instance, when we fill out, death certificates, someone just does not die from a heart attack, but we list anything else, whether it was depression, whether it was homelessness, whether they were a smoker, all those determinants factor into why these group of people are disproportionately affected and had this certain outcome. So although they may have COVID-19, we usually see a link and similarities and some type of recurrent theme. So yeah, so we just want to advocate that the whole stories are told in addition to just the COVID-19 that has sparked the highlight. But thank you for having me. And if there's anything that I can do to continue to support the cause, always so welcome to reach out.
Awesome. I appreciate that. Thank you so much.
Thanks, LaShonda. And LaShonda, while we have you, someone asked a question in the chat box, and I think as someone who has been a provider, you might have good insight on this. One of the questions was, what can we do moving forward as states are reopening to protect those who are most vulnerable to COVID-19, including those who are living with HIV?
I'll tell you, it's changing every day. And the only thing that I can remain consistent with is to continue to be an example as everybody is becoming very complacent in their behaviors. Continue to wear your mask, continue to use your hand sanitizers, and encourage your family members. I must admit, I could possibly become a bit complacent, but because I have a family member who recently died from COVID after being intubated for 5 weeks. And my grandmother had COVID-19. At times when I want to be lax, I can't because their death is not in vain. Just like those who are positive, at times when I didn't want to practice, the most safe sexual behaviors or other practices that will put me at risk, whether it was drinking too much or smoking too much, whatever, how dare I, because my mother did not die in vain. So I would just say just to continue to be an example, even when others may fall complacent, and just persist, just endure for those who have succumbed and for those that are still grieving during this most horrific time when we cannot be with our loved ones, and we cannot grieve together, but showing compassion, we can endure together. So I would just continue to encourage that.
Yeah, I think that was a really great point to stay vigilant. And I think that you saying that is kind of funny because it kind of leads, I think, really well into the next question. So along with staying vigilant, what are some lessons that we learned through direct action from the folks from the early onset of the AIDS epidemic, like the folks from ACT UP? What are some direct actions we can do to hold our government leaders and legislators accountable for protecting those who are most vulnerable? And that's for all of the panelists, if y'all have any insight on this.
Excuse me, I'll just be brief, but, as the NCAAN folks know, I have got that direct action bug, and sometimes, I'm very militant about it, but because I lived through that and I saw how that worked and how effective it was. I lived in LA at that time, and I remember how effective direct action was, because politicians just hate that. They hate direct action, and bureaucrats hate direct action. But we're in a situation where it's hard to do direct action without putting people in jeopardy. But I know that we're working on some stuff. I mean, Lee and the executive committee and I have been talking about Senator Berger, who keeps blocking the introduction of a Medicaid bill to the legislature, which is really important. And we're talking about ways to actually get a meeting with him and to actually do things like other groups, our coalition partners have done this month, which is to flood his office with phone calls. But I think these folks in the legislature that are standing in the way of what is really needed, we need to take action to bring out to the public, to show the public what these women and men are doing and how harmful it is. And we have to keep doing it and doing it and doing it and make them feel uncomfortable. It's that uncomfortable feeling that they get that either gets them out of the way or makes them change. So that's my vote. And if we can help with that at all at NCAN, we want to do that. And it could be a good subject for our support group, could give us something to do, to work on methods of direct action or indirect direct action, whatever you're going to call it.
I agree with Tony. Getting leaders out of the way may be much better than giving them phone calls. But that's just my opinion. I wanted to, if I could take a minute, since we were talking about positive outcomes. LaShonda, thank you for the inspiration. Tony, your ideas are really great. And if we could build a network of long-term survivors, that would be awesome. I know living in Wilmington, I don't necessarily have the resources to join you all in the Triangle or Charlotte or Asheville frequently enough to build a coalition. But doing Zoom meetings has taught me that long distance togetherness is possible. But one really positive outcome that happened from those ACT UP and direct action days was the research was accelerated, very obviously. But also when the quilt happened, the AIDS quilt, it created a sense of empowerment and strength. And once our shock and grief was, able to be overcome a little bit, we were able to build the quilt community. And that positivity and memorializing those that are lost to AIDS could hopefully will begin to happen now as we're losing so many more to COVID-19. When the death toll from COVID-19 weeks ago passed 58,000, I couldn't help but remember the losses due to the Vietnam War. And that was, 15, 20 years of loss of life that we experienced here in the space of 4, 5, 6 weeks. It's overwhelming. And if we can begin to memorialize and remember the talent that's being lost today to COVID-19, I think that will be a positive outcome.
Awesome.
This is Esther. I wanted to add one positive outcome was when they had the symbol of hope. For HIV, it was the red ribbon. And I feel that we're at a time now that we need to have some kind of symbol of hope for individuals with HIV. Also, one thing, I'm so blessed to have worked with NCAN over the years, and one thing that would move one legislator that was really adamant, he didn't support any HIV programs or anything. But when we showed him data or information about the cost that each community have as far as, you know, a person ending up in the hospital with HIV and COVID, how much the cost would be, that swayed him, and he's become one of our greatest supporters. And I think now in this time where everybody is looking at money, I think that would be a great advocacy tool to use to let them know, hey, to have someone tested, to have someone treated, to make sure that they are tested before they get to the point where they go into the hospital is more cost effective than having someone that tests positive end up in a hospital on a respirator. And I think showing the correlation between that is a very important tool to communicate to our legislators, since they're all focusing on opening up the economy and everything like that. Well, you let's look at how much it is costing people to go into the hospital for COVID, and how much that money could be used to do other things like treatment and testing, as opposed to waiting until someone gets symptomatic. So I think maybe NCAAN, if we can do that again, we can do that through a Zoom or sending documentation. I think that would be a very effective advocacy tool.
Yeah. So to be cognizant of time, we are a little past 11, so I wanted to go ahead and start to wrap things up, just to make sure that folks are able to join whatever else they've got going on today. I think Esther just made a really great point to kind of help us wrap up, and kind of a shameless chance for us to plug something. So we have got our first ever HIV Virtually Speaks on Jones Street 2020 coming up on June 10th. 2020, which is a Wednesday in June. It'll be a virtual meeting where we will start having conversations with legislators via Zoom. We are cognizant that we will not be able to host HIV Speaks on Jones Street in person, but we still want to be able to advocate for our community and host those meetings with representatives. So I have just now dropped the link in the chat function. We would love to have y'all join us and register for that. It's a great chance to meet with your representatives from a distance, from a safe social distance. And talk about things that are impacting the HIV community, and talk about some of the things that Esther just mentioned. We will continue to send out this links and the information that we talked about, as well as the recording of today, and a follow-up email to all of the folks who registered today. I want to give a huge thank you and shout out to all of our panelists and folks who spoke today. Thank you to all of y'all who joined. And Lee, I think we are good to go ahead and stop the recording. And y'all have a wonderful rest of your Thursday, and look forward to this continuing in the weeks to come. Y'all have a great rest of your day.
Thank you.